So here we are in the beautiful Ugandan region of Lake Victoria, which you can see behind me. We're on one of many islands that are actually located in Lake Victoria. We're currently running a medical camp, which is offering free medical treatment and medication to the rural communities here. I'm here with Sally, who's been our key operative to be able to make this this initiative a reality. Sally, would you please introduce yourself briefly? And yes.
Thank you. Hello. You're welcome. My name is Sally Africa. I am Ugandan by both birth and uprising. I run an organization called King's Daughters Foundation.
Yes.
And for the past about 7 years, we've done healthcare camps in hard-to-reach areas. And the vision really started from I was doing some outreaches out in the villages. I'm a social worker by training.
Yes.
And we found out that there were so many children, especially, who were dying not because they had such complicated diseases.
Right, but it was simple things that could be handled by a field medic.
Exactly,
right?
But then we know that there are areas in Uganda where there are actually no healthcare facilities.
They just don't have any access, aside from the fact that, you know, infrastructure, you don't have a road where you can just jump in your car and drive on a highway and in 5 minutes you're at a hospital, right?
You saw this today, you had to get a boat to come here.
Exactly, now, on a canoe to get to this island, right? So
there's no other way of getting out of it. Like this particular island is called Bunyama.
Yes.
There is no health facility on it.
Right.
So this is the first time for some of these people to actually see a doctor. Since the children were born, they're
the strategy is simply, if they can't get to the hospital, we bring the hospital to them.
Exactly.
Yes.
And so the thing is, we like to work with the local healthcare providers. So right now we are working with the main island, which has a health center for. They would not be able to come out here because, one, they have no means to do it. So part of the beautiful thing about working with the organization is that you provide us with, for example, transportation, which we will not be able to do if we on our own, and also the medication.
Right.
Most people that do healthcare camps, they don't provide medicine.
So how did you hear of Sponsorship Network? And what's the role the Sponsorship Network played in order to make what is happening today a reality?
Well, really everything, because what organization does is provide the personnel. We have the doctors, we have the nurses, but we have no financial assistance.
The funding.
The funding,
right? So we don't backing. You don't get state backing.
No.
And so you're actually dependent on independent NGOs to be able to actually do it. You have the will, but you don't have the means.
Exactly.
Okay, and that's where Sponsorship Network came in. They provided you the means.
Yes.
How did you hear of Sponsorship Network? Actually, it would be interesting for me as the director. I'm not even.
Actually, I heard it from, there's a friend called John, he works in Turkey.
Right.
So he met, he knew what I was doing.
Yes.
So he said, there's a friend of mine coming over from Hungary. Would you like to meet with them?
So word of mouth, basically the most classic form of business interaction, relationships, networking.
Yeah.
We've done 4 medical camps together.
Yes.
How is your experience? And let's give us a brief summary. What were you able to accomplish as the coordinator with your medical team over the past 2 days for these families and these individuals, these children in these rural communities?
Now, for example, yesterday, we did a whole day and we were able to treat 400.
Wow, 400 in one day. How many doctors do you have right now?
Right, yesterday we had 6 doctors.
6 doctors and 400.
Yeah.
That's basically, that's 80, if I'm not mistaken, almost 80 consultations per day.
Yes, but you know, according to the WHO statistics, it's supposed to be 1 doctor to 1,000 patients.
Wow.
But then in Uganda, we have 1 doctor to 25,000 patients.
Okay.
So
there is an incredible lack of competent medical professionals.
So when people hear there is actually a doctor coming, they will travel miles. Actually, half of these people came from another island because they had there was a medical.
So they actually made the extra effort to come over here. So this is for them really something that they value. They'll basically take an entire day out of what they'd otherwise be doing, which would be fishing, agriculture, and so on and so forth. Huh?
Yes.
That's how much they value it.
Because it's all the government facilities are not available, and even if they are, there's no treatment that comes from them. So.
And I saw we have a field apothecary.
Yes.
So once they get the diagnosis, if they're able to, if we have the medication on hand, they can basically just pick it up.
Yeah.
It's free of cost, if I'm correct.
free.
I mean, that's
Yeah,
we're
because
subsidizing it.
exactly.
You know?
Yeah.
Thank you to our sponsors. Huh?
Yes,
You subsidized it.
True.
And so they're able to get in a very small amount of time, you know, basically a complete medical diagnosis, analysis, and treatment.
We even have a lab where we're testing HIV, we're testing what the basic kind of lab that some of them have never been to a laboratory before.
So this makes it an incredibly efficient module to be able to treat a very large amount of patients. I mean, if you're doing 400 per day, right, in 2-3 days, you're able to treat and diagnose
over 1,000.
Thousands of
because like today we have registered already 300.
Yes.
So far within just 3 hours.
Wonderful. It's been amazing talking to you. Thank you so much for allowing us the opportunity to support you in this crucial work of bringing medical needs. And again, we're not talking about high-level medical analysis. It's just basic hygiene, basic things that allow these people to live a good standard of life. Sally, thank you very much for giving me and our sponsors the opportunity to support you in this initiative.
And I just want to thank each one of you for being part of this, because you don't know how many lives you're saving by your contribution and your partnership. So thank you very much, and may God bless.
Thank you. It's been an honor for us.
Thank you.
Thank you.